Hi, my name is Laha, and I'm here to talk to you about the COVID-19 vaccines. Wait, please. Before you decide you want to close this video, just stick with me. Hear me out until the end. I promise it will be worth your while. Let's cut to the chase and start by clearing the air. It is okay if you're hesitant about taking the COVID-19 vaccine or worried about side effects. When we're facing something for the first time, our survival instincts kick in and our fear responses are activated to protect us. Because that's all what fear really is. It is our brain saying, hey, I don't know what this thing is, never seen it before. It's new, it can be dangerous, so I'm going to stay away from it. It is literally the way our brains are wired. Fear is simply a protective mechanism that evolved with us. But let's not allow fear to control us, especially when lives are at stake. I understand there's just tremendous amount of information and misinformation out there that it is hard to tell what is true and what is not. And for that purpose, I decided to contact a group of amazing experts who dedicated their lives to science and asked them about the coronavirus, also known as the SARS-CoV-2, and the vaccines. So let's hear what they've got to say. We first asked a molecular virologist what do the terms double and triple mutants mean, and this is her answer.
So the double and triple mutants refer to mutations in the viral spike protein, which is the protein on the surface of the SARS-CoV-2 virion, which helps it to bind to and gain access to our cells. It's normal for the virus to mutate. Some mutations have been identified as variants of concern by the World Health Organization because they confer either increased spread, increased infectivity, or increased severity of disease. So for example, the Delta variant, which was first identified in India, is rapidly becoming the dominant variant worldwide. And this variant has 3 mutations in the spike protein which help confer increased spread, increased infectivity, and increased severity of disease. Vaccination can do a lot to protect us against this variant, and actually 2 doses of the vaccine will allow protection of over 90% against hospitalization and severe disease. And so what this means is that really we just need to keep making sure that we vaccinate our population in order to protect our friends, families, and our communities.
Next question was directed to an evolutionary microbiologist, and we asked him if the vaccines are causing new variants to arise.
The short answer is no. It could be a contributing factor, but the main factors that play a role in the evolution of new variants are viral population size, so the number of viruses, and also the selective pressure that we're putting on those viruses from immunity due either to vaccines or natural immunity. There needs to be enough copies of the virus for evolution to happen. So that's why combined with vaccines, just keeping the number of infections as low as possible, probably the best thing we can do to reduce the evolution of new variants.
We also asked an infectious diseases physician if the pandemic can be controlled without people getting vaccinated, and this was his reply.
I think we actually know the answer now. And the answer is that without vaccination, this pandemic will not end. Sadly, natural immunity is simply unable to control COVID-19. We've seen it. Natural immunity wanes over 3 or 4 months, and people are susceptible again. And perhaps even worse, even during those 3 or 4 months, a new variant can easily bypass natural immunity. And we've seen in Brazil, the P1 variant cause huge outbreaks in previously infected communities. Vaccine immunity is better than natural immunity when it comes to defending against those variants. So for me, the only exit strategy is vaccination.
We asked a microbiologist and an immunologist whether the vaccines were rushed products or not. And this was her response.
No, not at all. The mRNA vaccines, the technology itself was not just discovered. It has been proposed since 2012 on HIV. Several clinical trials are ongoing on Zika, on influenza, all way before 2019 when the COVID hit us. So when COVID hit us, the technology that was still under clinical trials for using mRNA as vaccine was there. Vaccine was not rushed. The technology was available, and the process of testing the vaccine went exactly by the book. There were no shortcuts, there were no rushing, and it satisfied every requirement for safety and immunogenicity of using such vaccine.
And there you have it, folks. It's good to be cautious, but if we don't reduce the number of cases, we are going to have new variants coming out. And the fastest and most efficient way to reduce the number of new cases is to get the jab. we want to get out of this pandemic with minimal loss of life, we need to show up. We need to show up for ourselves, we need to show up for our loved ones, and we need to show up for our communities. One last thing, we're still not out of the woods yet. Hopefully we'll be soon, but until then, even if you're fully vaccinated, please continue to wear your mask and keep your hand sanitizer nearby. Stay safe and stay healthy.